Hello everyone. Today we are going to see one of the clinical regional repertory which is based on the part. The name is Skin Diseases by Douglas. This book gives a detailed account of major skin conditions with their causation, diagnosis and homeopathic treatment in the most easy and comprehensible manner. Its full name is Skin Diseases. Their description, etiology, diagnosis, and treatment according to the law of similars by Melford Eugene Douglas, MD, was published in 1899 and reprinted in 1998. It is essentially a therapeutic book which deals on various skin diseases. The classification, discussion, and the approach is complete and practical from the homeopathic point of view. This book is originally published in 1899. The work has been written in the first instance with the view of meeting the wants of the homeopathic practitioners in his daily dealings with diseases of the skin. At the same time, the needs of the medical students in preparing for his examinations has been kept constantly in mind. The author has endeavored to present his subject in the most practical manner and with the fewest possible words consistent with an intelligible presentation of the same. To this end, he has avoided all theoretical and controversial discussions which are of interest to the specialists rather than to the general practitioner or the students. Now we will understand the book in the form of chart. The name of the book is Skin Diseases, their description, etiology, diagnosis and treatment according to the law of similars. The author is M. E. Douglas, M.D. It was published in 1899, reprint edition in 1998. There are number of chapters are 21. Typography, single grade, that is Roman. Type of repertory, it is a clinical regional repertory based on parts. It was published by B. Jain Publishers Private Limited, New Delhi. Printed in India by J. J. Offset Printers, Delhi. Now about the author, Melford Eugene Douglas, MD. Lectures on dermatology in the Southern Homeopathic Medical College of Baltimore, MD. Author of Characteristics of the Homeopathic Materia Medica, 1905 and Pearls of Homeopathy in 1903. Now we will see the preface, what is given in preface. In preface, author states that book has been written to meet the wants of the homeopathic practitioner as well as the need of the medical student. He encourages the physician that he should be proficient in the principles of general medicine and in knowledge of the general course and behavior of skin diseases, in order that he may treat affections of skin intelligently and successfully. Author gives priority for cause and totality of each skin elements for a successful prescription. Now we will see the chapters. The first 4 chapters were spent for giving an introduction about general anatomy of the skin, general observations and rules for studying skin diseases, classification of the elementary lesions, etiology of skin diseases, etc. From general observations, points which are worthy to note are as follows. Symmetrical presentation of skin elements are due to blood poison. Next, among the temperaments, lymphatics are prone for eczema, impetigo, intertrigo, pustular scabies, ringworm, rheumatic for erythema nodosum, strumous for eczema, lupus and florid for psoriasis, etc. The next one, considering occupation. Cooks are liable to eczema and erythema. Bakers, grocers, then comes the bricklayers for lichen. Chimney sweepers for epithelioma of scrotum. Cotton workers for urticaria. Butchers and graziers to whitlow. Boils, malignant pustules and eczema. Shoemakers for eczema, etc. Then comes the general interpretation that diseases of children are the result of malnutrition from deficient of bad feeding of adults, results of mal-assimilation and of age due to generative or degenerative changes. Then comes the derangement of four organs: stomach, liver, kidney, uterus, excites and intensifies the skin mischiefs. Now we'll see the chapter 5, what it contains. Local dermal inflammations, which includes erythematous diseases, erythema multiforme, erythema nodosum, roseola, urticaria, follicular hyperemia, medicinal rashes. Then comes the chapter 6. The eruptions of acute specific diseases like variola, varicella, typhus rash, typhoid rash, measles, scarlatina, erysipelas, rubella, frambosia. Then the chapter 7. Papular inflammations like lichen planus, rubor simplex, scrofulosaurum, strophulus, and then comes the prurigo. Then the chapter 8 contains eczema. Then chapter 9, bullous diseases of and anomalous forms of bullous eruptions like herpes labialis, herpes progenitalis, zoster, pemphigus, pemphigus vulgaris and foliaceus. Then comes the hydro. Then chapter 10 contains suppurative inflammations like impetigo. Then comes the eczema, furuncle, stye, carbuncle, pustula maligna. Then chapter 11, it contains squamous inflammations, pityriasis rubra, pityriasis pilaris. Then comes the psoriasis. Now we will see the chapter 12. Diathetic diseases, scrophulodderma, syphilis, condylomata, leprosy, Morvan's disease. Then comes the chapter 13. Hypertrophic and atrophic infection, which includes corns, horns, warts, ichthyosis, morphia, scleroderma, scleriasis, scleroma. Then comes the keloid, fibroma, dermatolysis, elephantiasis. Then comes the mammalitis. Then comes the anum nevus. Then comes the next chapter. It includes the neoplasmata, lupus erythema, sarcoma, carcinoma, rodent chapters. Then comes the 15th one, chapter 15, cutaneous hemorrhages, purpura. Then chapter 16, pruritus. Chapter 17, chromatogenous diseases, vitiligo, melanoderma. Then chapter 18, parasitic diseases. It includes then the scabies, fevers, trichophytosis, then onchomycosis, paronychia. Then comes the chapter 19. Disorders of the glands include diseases of the sweat glands and sebaceous gland. Then chapter 20. Diseases of hair. It includes alopecia. Then chapter 21. Various lesions not classified. Perineal. Then comes the wash leather skin effects of rust stalks on the skin. Now we will see the construction of chapters. A general pattern followed in each skin diseases is as follows. A general introduction. Then comes the pathology and etiology. Then comes the diagnosis. Then comes the prognosis. Then comes the treatment including appropriate external applications and homeopathic therapeutics with brief description of symptoms. Many conditions were presented only in brief paragraphs according to their significances, and some are presented without any therapeutics too. Now we will see about the repertory part. There is no separate sections for repertory. Considered only in chapter 13 under verrucae or warts. Repertory of warts and repertory of condylomata separately prepared by Olin M. Drake. Use only single grade of evaluation with typography of normal Roman. Followed an alphabetical order of arrangement. Cross-reference were used. Rubrics for horses and sheep etc. too included. Total number of medicines are 90. There is another similar repertory section in chapter 16 for pruritus with an additional 48 medicines. Repertory of wards, few general rubrics. Then subsections like locality, under which various locations are given as rubrics alphabetically. Rubrics from anus about to, then tongue upon. Objectively considered, where objective findings are given as rubrics. Rubrics from bleeding to ulcers. Subjective symptoms, where patient's subjective symptoms are rubrics. Rubrics from burning to tickling. Then the repertory of condylomata. Here you will find general rubrics. Subsections like locality. Rubrics from anus upon or about to vulva upon. Objectively consider the rubrics from bleeding to white. Subjectively, rubrics from burning to stitches in. Repertory sections for pruritus. Just like therapeutic notes of homeopathic medicines, starting from itching as from ants to wandering. Separate sections for locality, anus and sexual parts as rubrics. Then comes the index. Towards the end of the book, index has been done. Now we'll see what are the merits of this book. This is a book exclusive for diseases related to skin, and all rubrics are present in a single chapter at one place. Repertory part for warts and condylomata is useful due to simpler construction with worthy rubrics having only 90 medicines, which are found easier during clinical application. Some special rubrics such as cons, aphelis, herpes labialis, hordeolum, ingrowing toenails, disorder of perspiration, paronychia, scleroma, scleroderma, seborrhea are mentioned. Then comes the demerits. It is a useful book from the homeopathic point, but it lacks the completeness and needs an update as per the recent advances in the field of dermatology. Many of the clinical conditions mentioned under the Douglas skin repertory are older terminologies which are reproduced with new terminologies in newer repertories. So, the clinical conditions are presented with few or no medicines in Douglas skin repertory but are upgraded with many medicines in newer repertories. Now we will see the concluding part. This shows that the book, though written long back, is still a complete guide on skin diseases and its use holds good even till date. It can be used by beginners and stands as a reference when there are few symptoms and confirmation for diagnosis needs to be established. Thank you.